when people got together, joints were passed around.
Marijuana is a drug with potential health impact.
I have never seen a cannabis overdose.
It's Reefer Madness, the podcast, with Trevor and Kirk.
Kirk, we're back.
Hey.
This is the second time.
Trevor?
Really good. The second time we're talking with Yvette. And this time we actually finally get around to talking about shoving things up your nose.
Yeah, the Nozzr. It's quite the product. It's quite the product. As I said in the Cream of the Crop edition, this is a lady that I contacted to talk specifically about this product that she sent me. Unsolicited, she sent me this product. And we got into a longer discussion, and that was the other episode that you should go back and meet her again. But this is her product called the Nozzr, and I love the history. Again, I did not know the person I was talking to. It was a cold call. We started talking. I discovered she's a respiratory therapist. She's a lady that has MS, and she uses cannabis therapeutically for her MS. And she calls herself a unicorn because her MS is different. You are a man that's very in tune to MS.
We'll say I've got an interest in it. I'm not an expert by any stretch, but there's lots of people in our area with MS. So I just talk to people in my day-to-day with MS. And for a bunch of years, I was involved with the MS Society, so got to meet a whole bunch of other people with MS. So yeah, we'll call it a special interest of mine, but it's not like I'm an MS pharmacist or anything.
No, but you understand MS, you understand the process, and you've got a clinical understanding of MS.
Sure.
Do you know many of your MS clients are using cannabis as therapy?
People have been talking about using cannabis for a long time. Stativex was a commercially available, actually nasal spray. But it hasn't been, it wasn't pulled from the market or anything, but I haven't seen it around in several years. I'm going to say it sort of became, I'm getting my timelines a little off, but I'm going to say 10-ish years ago it was around, and it seemed to be both THC and CBD in the spray, if I'm remembering properly. And yeah, so people have been, and when legalization was commercial rec legalization was talked about, people in the MS world were talking a lot about, should they use it, shouldn't they use it, what should they be looking for. And one of the practically controversial statements about cannabis is cannabis being used for MS spasticity is pretty much, there's like about three things that no one argues that cannabis can do, and MS spasticity with cannabis seems to be one of those things that no one argues that's a treatment.
So it does actually diminish the spasticity.
It does, yes. And
do we know if it's the CBD or the THC or the combination of both? Or
I don't know if we know that.
Okay, fair enough. And I didn't mean to test you, just that I know you have an interest in MS. Why don't we just jump into the conversation? I think you can sense that I'm enjoying the conversation, and it went way so long. And again, hear Clive in the background. Her husband was obviously there helping her because she talks about getting a brain fog every so often, and he was throwing sort of like tidbits out as she was talking to me. So listen for Clive as well.
All right, let's listen to Yvette.
So it all started with COVID.
Everything started with COVID.
I know. And also I was around during the first SARS. I wasn't working clinically, but I was working in the industry, in the medical industry. And so I still had a lot of colleagues working. So we knew a lot about the whole respiratory. And so when COVID first came out, everyone was trying to figure out what to do. And they were doing mouthwashes and rinses and stuff for the throat, and this virus hangs out above your oral airway in the nasal pharynx, and that's where it accumulates. And so there were two studies, and again it goes back to terpenes. There were two studies that were done by the same author, Yang et al., 2012 and 2011, on terpenes and coronaviruses. So with my background, a lot of respiratory viruses are coronaviruses. So they have that shape, they have those spikes. Some flu viruses also have that. And so this was done in bird flu, these studies. And what was interesting, and I shared the articles with some of the brainiac PhD people I know, because it took me 10 years to do a degree in biology because I was working and stuff. And then when I finished it, people said, so are you going to go get your master's? I'm like, no, I'm good. And so the papers were done really well because not only did they say, oh, these terpenes can stop the virus, they actually showed you how it did it. And it didn't care what the spike was or what mutated on the spike. It allowed the virus to go into the cell. But viruses, all they want to do is make copies of themselves. That's their goal. So it lets the virus go into the cell, but it messes up so it can't reproduce. And that's how it decreases the virus. It kills the virus. And so because they were terpenes and, my brain plant-based, if we can decrease the viral load, our philosophy was, well, if we could make a product similar, we were doing the hand washing and masking, back and vaccines weren't out yet. So if we could spray our nose and reduce the viral load, then, we could work with that. And so the two terpenes are 1,3-cineol and pinene. Okay. Are the two. And so we made a dosed, that's another thing on medical we can talk about is dosing cannabis. So dose nasal spray, this was a child lock at the time, right? And throw in CBD because CBD is so good with just tempering your immune system if it goes crazy. It's a great anti-inflammatory. Understanding the structure of the nose and the layer of mucus, and what's in the mucus are your immune cells and how you could capture that. And so we did a formula and we were using it same, you go out, you spray your nose, you come in the house, you wash your hands, you spray your nose. And that was, where we were starting to work with this. And then we thought, okay, we knew that once you started having symptoms of COVID, it was in your chest, right? You started getting. So how do you translate that, those products to the chest? So it was about, well, we still want to vaporize it and we want it to go into the lungs. But it'd be good if it could go through the nose too, because that's where everything comes in through the nose, right? And accumulates there. And so this was, vape carts. This was early vape carts. Like we weren't even talking about that.
So you put that knowledge together and you said to yourself, only as a respiratory therapist can, is I've got an accumulation of viruses in my nasal pharynx. I should flush that with nasal rinse or terpene rinse or CBD rinse. So you're thinking of prevention as well, and you come up with this Nozzr, and obviously from a recreational perspective, this also has benefits. But so carry on from that. I just wanted to just make sure I'm on the right track.
So we figured, okay, let's try and do a vape cart with the terpenes and some CBD. And back then, that's when, all the stuff about they were putting in fillers. And so I worked with just CBD and the terpenes and some other terpenes because eucalyptol can be pretty nasty. It can be very off-putting. So, and even in the nasal spray, so there's other terpenes in there that temper that, so you don't even.
Oh God, that would blow your eyeballs out if you breathe in eucalyptus your nose.
And then, so again, my background in respiratory therapy, we used to have these little devices like that and they were called, they were used for neonates to clean out their nostrils.
Yeah, little vacuums, right? Little, yeah.
It's the shape of them.
Yeah. I've used them. Yeah.
Yeah. So, and I used to work for that company. So one of the companies that did a lot of neonatal products. So I worked on that design idea, but went with the two prongs and worked with Tilt Holdings, which is C-Cell, which makes cartridges, vape carts, and batteries. And they donated all kinds of product for us to play with. And we got, and so we figured it out, but then the vaccines came out and everything. And at that point, I wasn't even thinking about cannabis as recreational, because back then the vape carts out, you could smell and taste butane, and, products weren't clean at all.
Yeah.
But we still went ahead, and because of my background too with, asthma and stuff, and there's some nice little handheld nebulizers out, especially in the European market. In Canada, we like MDIs. We like the puffers.
Yeah.
Other countries do not use the puffers as much as we do. And so I knew that because of my background in industry as well, and working with companies that had these handheld. So I also thought of it that way, of getting product. You think, oh, the nose is going to capture everything, but you need the right size of aerosol, and it'll go through the nose and into your lungs.
Yeah.
And it's a lot easier to do than going through your mouth. It's more natural and breathing, but that we'll talk about Nozzr with that. So we went ahead and further developed this. So we found a local company to do 3D printing, started there. And at one point, some mucky mucks from Tilt Holdings were in town in Jupiter. And the local manager, Jerry, we sat down and met with them. And by then, some of the vape carts were getting better. They were getting more into the some cleaner resin.
Okay.
And so we met in a second cup, and of course they all had their vapes with them.
Yeah, everybody has their vapes. Yeah.
So one of the attendees took out a vape cart, and we gave them each a Nozzr, and they passed around the vape cart with their own Nozzr, and they were experiencing different flavors and tastes. And this one woman swore she could taste juicy fruit gum.
Yeah.
In that vape cart. And so, and we know that 80% of taste is through your nose.
Yeah.
You have a cold, nothing tastes right. And so it was quite interesting at that point. And we're like, okay, so maybe we are onto something here.
Oh, yeah.
And then,
you are, actually. Yeah.
And so we, we're a party of two. And so things, even from designing not only the product and figuring out how to do this and not speak Mandarin,
yeah.
And the packaging, we want something disposable, but we want something we can use a picture, because we're not cannabis.
Right.
We got to have English or French. We have to put the warnings on, because we don't want, try it on nicotine. I dare you.
No, I don't do nicotine, but I imagine it.
But I double dog dare anyone with a nicotine vape to try that, and they will never do it again. It's just, But, and then we also had to put a warning on there, and people have to understand this about choking hazards, small parts, not for children under 3 years, or any individuals who have a tendency to place inedible objects in their mouths.
Yeah. Well, it's like
English and French.
Yeah, but it's like ladders. You have to tell people this ladder is unsafe.
Don't go on it.
Yeah. So how long has it been on the market?
So it's been on, we thought we've been so naive, and industry's different, and we were out of commission for 5 years between the MS and the myeloma. But I mean, people were like, people who saw it think it's weird. Some people find it triggering if they've ever had a cocaine addiction.
Interesting.
But people who are vapors, we're finding out that, you read about these people, some people will go through a gram cartridge in a week.
Yeah.
And so why is that? Part of it is trying to get to that level that, and I've done it when I wasn't consuming the right cannabis. You're trying to get to that point. And you're chasing, right? And that's when the only time I really greened out, but not understanding things. But what we've noticed is because you're now going through the nose and your olfactory organ, your smell organ, has endocannabinoid receptors. And so they can transmit right into your amygdala, which is about memory and stuff, and that's part of smell too, but also it can quickly go into the areas where you have the CB1 and CB2 receptors. So I think part of it is, and this is just my theory, is when you inhale orally and you go through your lungs, then you go through your blood, then you have to distribute it throughout your body. And for certain things, you really want to go to those receptors in your brain, especially chronic pain, anxiety.
Yeah.
And so if you go through your nose, you're able to reach those quicker. And in body sense, milliseconds may make it, I don't know. I don't know enough about this. It's just questioning, but we've seen it. And what's happening is people are requiring less. And there's an issue with tolerance. If people are hauling on a vape cart orally, they can help with their tolerance if they start a different route.
Yeah, no, when I told Trevor that I had received these two Nozzrs, we both had a good giggle over it.
Oh, yeah, I know.
Yeah, we had a good giggle. But I started questioning about the whole pharmacology of it, and I've done scans and I'll do a little bit more reading when I talk to Trevor. But I'm looking forward to Trevor to talk about this because I see this as both medicinal and recreational benefits. Medicinally, of course, like you said, when I tried this, it was almost immediate. The first thing that popped were the terpenes. It was like, I think I said to you that I grow my own, and I've been consuming my own usually through smoke, and as much as I like vaping, I find vaping sometimes just a little too difficult. It's easier just to take a reefer with me for a walk or a one hit and go for a walk. I like my flower, right? But I tried this, and it was immediate. It was like, oh, I haven't smelt those terpenes in my grow, in my AK-47 grow. That's astounding. And then I realized, oh, hold on. This is
yes, I know.
It's hit faster. And those were two real life applications. And I went, there's something here. This is, because again, as a nurse, I can't get gifts. But I will say that this was unsolicited, and I guess you can confirm that. Thank you for sending this. But I will recommend nasal inhalation as medicine and also for flowers. I mean, I don't recommend vapes. Like I think, again, I told you, I don't use vape cards. I don't get them. And the people that I know that use them ironically talk about their anxieties. And it's like, well, get away from the vape cards,
Well, and that was the thing, like part of it too was that with vape carts, and when I couldn't get any effects off vape carts till I went nasally because of the terpenes. And part of it was learning about three things. The only cart I will use is anything that's fresh rosin. Okay. I'm a hash person. I grew up in Northern Ontario, so we had, biker hash and whatever someone grew under the hydro lines, right?
Yeah.
And now we've got a whole bunch that we're going to make into hash. We're just, the weather's a little too cold to do the ice hash right now, but yeah.
Interesting.
You probably have patients has seen that, and we can go on a whole thing about bad research in cannabis and people who consume nicotine, the smokers and tokers, right?
Yeah.
And they still like to toke, but they cough.
Yeah.
The COPDers, we have a colleague who's like that. She's in her 60s, and she doesn't smoke cigarettes anymore, but I asked her about her smoking history because, I was in smoking cessation, and, I said, so how much was your smoking? She goes, I could eat them. She said that's how heavy. So she's the cannabis consumer who loves to inhale, but coughs a lung out every time, right? But she'll even on a vape cart, but as soon as she goes through her nose, guess what? She doesn't cough. So there's probably a list of things about we can go through about what happens when good things about inhaling nasally, and one is it reduces cough because that's what your nose is made to do. It slows down the airflow and it puts humidity if it needs it, or changes the temperature of the vapor to mimic your body temperature, and then it goes over your vocal cords and everything else, so you don't cough. It really can make a difference. But at the same time, some people, on your diabetes one, yes, always low and slow, even with nasal inhalation. We always used to do this.
Yeah. So
I was like that too till I had my physics training in aerosol therapy and fine particle physics, and anything under 5 microns is going to go in your lungs. Let's just put it that way. But airflow and fluidics of dynamics, those things will go to the area of least resistance. They'll find their way.
Yeah, I was just thinking, like I said, we talking to Dr. Robinson about inhalation therapy for diabetics, and I can't help but think that this is the way to go. Not just vapors. You get less hydrocarbons from the actual plant-based biomass. If I was going to recommend somebody inhale cannabis for medical purposes, the Nozzr through a vape, it's brilliant. It's truly a brilliant medical administration of cannabis.
You know what? If you put a timer on there, now you've got dose. So if you time your inspiration.
Is there any question I didn't ask you that I should have, or that any points you want to get across?
With regards to the Nozzr, I think, like you said, medical and recreational. Yeah. We know that we have people who have who are like quadriplegics. So this is inhaling through your nose. You don't have as much effort.
I never thought of that either.
Because you have to cause negative pressure in order for the air to move in your lungs. And you have a bigger volume in your cheeks to make that negative pressure than your nose. So the airflow gets up fast, high, and quickly without effort. So there's so many things about why we, and if you go back to some of the history of cannabis use and what they found in archaeology, where they believe people were like under a blanket with the seeds or the plant material. So, they weren't going with their mouth open. I think revisiting that for many reasons and looking at where those receptors are. And we've had people use this for migraines. Yeah. Really bad TMJ, and because the trigeminal nerves go in here, like there's just so many different things, and people say, oh yeah, I'm interested in cannabis, but I don't want to smoke, because they think they see the rolled cigarette. So something like this offers them something. The problem in medical cannabis is we need something that's predictable for onset, duration, and effect.
Okay. So where can people find this product?
At Instagram at Nozzr Nation, and also on our new launched Cream of the Crop Therapeutics website. There's a link there for purchase, and provinces that are looking at bringing it in as an accessory, a cannabis accessory. That's right now.
Paraphernalia.
Yeah, I know. And that's how do you code it? It ends up under smoking accessory. So we don't need to age gate it.
Since we're carrying on this conversation, trouble is in Manitoba, pharmacists, Trevor is working in a fuzzy area of his practice, because Manitoba pharmacists do not encourage their members to deal with cannabis. So Trevor's very reluctant to to do much with cannabis in his practice. But I've been making this. We're allowed the Cannabis Act allows us to make cannabis in our homes. So I've just used extra virgin olive oil as my carrier, and then the beeswax is what gives me the consistency of melting it on. So the base oils you're talking about, are they olive oils, or what are they? Are they petroleum oils?
No, this is all
Cotton?
pharma blended.
Okay.
But there's no nasty stuff in it, and I don't know enough about the compounding world on doing that. But these are creams they use for hormone replacement therapy.
Okay.
And testosterone, but the key one was wanting to look at something, the fact that they had their own in-house data on CBD and skin penetration. It was really not that they share it. I've tried some other base creams. There's a company actually in Vancouver, and it's good, but the best one, and it was funny, one of our friends said, you have an amazing pain cream. It's unfortunate, like, the industry isn't supporting it, and even to get it into some of the medical outlets, right? It was like, there's so many products out there that how do you try and separate yourself until people try it?
Yeah.
Right. And the things with topicals is there's so much problems with having the what do you call it when you do research and you've got the
controlled study,
not the prophylaxis of and so for a real topical to work, you need to look at it outside of 6 weeks. No, that's the other thing, is using it and giving your body time to absorb it and all that. And using enough. Like you say, you slather it on, which is hard sometimes. Some of these products are expensive. And the other thing with our products, and this is to do with terpenes and smell, is so important in resetting your pain and memory. And so the smell's important. And we've had different people smell our cream and they go somewhere. And we had 2 people go to Noxzema. They smelled Noxzema. And why was that? Because when they were kids, their parents used to bathe them in it. And that's where they went. Other people pick up another smell in our terpene blend.
Very cool.
So,
well, I got to spend some time on Cream of the Crop webpage. I didn't go there at all. I went to the Nozzr. I kind of read a little bit, and then I went and read some papers. And
we've got the old website up for Cream of the Crop that goes on more cannabis stuff, but we're really pulling back. And you know what? We've got all the formulations. We have like real world user experience, and so we're open to people if they want to explore that in the cannabis world, or outside of Canada into Europe, because Europe, same with Nozzr, Europe medically promotes vaping flower for breakthrough pain and stuff. In their medical patients.
Okay, so we're going down another rabbit hole.
I know. Another one.
This has been really cool. This has been cool. Thanks again, and take care, guys. Peace and love. And
you too. Okay. You too. Bye.
We're back, Trevor. So, I tickled my nose with the Nozzr.
Yeah, and before I ask you about that, I couldn't help but try to think, top of my head, I'm sure I'm missing stuff we put up people's nose in sort of pharmacy world. There's not a lot, but there's definitely some. There is, so if you've got allergic rhinitis, if you've got allergies, we'll quite often spray a steroid up there, and that's we call it a topical or a local effect. Like, we just want to sort of stay in your nose and sinuses, not go to the rest of your body. If we're trying to go to the rest of your body, well, some famous ones are Narcan. Like, if you have an opioid overdose and are going to die, you've got 2 ways of getting into the person. You can inject it, or you can spray it up their nose, and up the nose works quite well. If you have, and it's usually children, If you have children with seizure disorders, and again, when people are seizing, you don't necessarily want to put something in their mouth, so we'll spray midazolam up their nose to help with the seizure. So again, we're spraying something up their nose that we want to affect their whole body. You know, if it's a seizure, literally want to go in through the nose, through the bloodstream, and eventually to their brain, and it goes there fast enough to help with seizures. And then, you know, probably the most famous one that everybody's heard of, if they haven't seen, it's been in movies forever, is cocaine, where we're going to snort something up our nose that we want to affect our whole body. So, you know, I just had to do a quick little rundown of things we put up our nose in the pharmacy world.
Yeah, I also sort of kind of did that, and I was thinking the time I had an inner ear infection, and the doctor gave me a corticosteroid that was new to me. And again, it goes through the eustachian tube, I guess, and deals with the swelling.
Yeah, we still consider that kind of a local effect. Sorry if I'm splitting hairs, but we don't care. We don't care if that affects your big toe, but we consider the nose and the ears, and even kind of the back of the throat and the sinuses, all connected. So yeah, if we reduce swelling here, it unplug. For those that are just listening, I'm pointing at my ear. I'm pointing at my nose and my ears. We spray stuff up the nose, but all those, the nose, ears, sinuses are all connected, so it reduces the swelling in the ears.
And sorry for not doing my homework, but first past the liver and all that sort of stuff. When you're going through the nose, my understanding is that you are pretty much going straight to the brain.
Yeah.
Yeah.
Well, that was interesting. So let's put a pin in that. You're definitely missing the liver. So, you're going into the bloodstream without, if you swallow something, it goes through your stomach, goes to the liver before it goes to the rest of your body. There's lots of surface area in the nose and sinuses to absorb stuff, and lots of blood flow to absorb stuff. So you are definitely avoiding the liver and going straight into the bloodstream. That is for sure. Now, she was mentioning, and it's fascinating, and I'm not saying it's untrue, I just hadn't thought about it. Your eyeballs and your sort of the chemoreceptors in your brain, in your nose, are kind of bits of your brain that are sticking outside of your body. Like your eyeballs are kind of an extension of your brain that sticks outside of your body, and the little chemoreceptors in your nose are kind of extensions of your brain sticking outside your body. So are we getting, if we're spraying cannabis onto the chemoreceptors in our nose, is that getting straight into the brain? Yeah, maybe. That was really, really interesting. And then, that leading into, is this a good migraine treatment stuff? I honestly not sure, but everything she said made sense. Yes, and I guess like when you we're talking about a product that is for cannabis. So when you inhale cannabis through a vape or a reefer, it's going through your lungs, throat, your nasal, and going down into your lungs. There it is. But it's not the same effect, because I tell you, I used this, and I used it with a flower vape, and I tell you, as I said to her, the terpenes popped. It was like, honest to God, I have never smelt is the word. Yeah. I have never smelt my cannabis so vividly. It did hit fast. It hit faster, and it was really enjoyable. But anyways, what I thought this was cool about is she sent this to me, and she also sent me a little battery, again, unsolicited on my part. She sent it to me, and the battery, I went searching for the battery. The battery was for an isolate cannabinoid delivery system for a vape. I use flower vape, and I got to tell you, I wish I had this product when we were talking to Dr. Robinson, when we were talking about diabetes. Episode 165, Inhalation Cannabis Therapy Benefits Diabetic Patients. And, Dr. Robinson basically said that, it's odd for a doctor to inform their patient that they should smoke something as medicine, because, of course, intuitively we don't want the hydrocarbons into our lungs. So
a vaporizer is a much better product to use than smoking a reefer, because you're getting vaporized cannabinoids and terpenes opposed to the carbon from the plant material. So with this, I'm thinking medicinally, this has merit. So as a medicinal cannabis user who's using vaporized flower, this Nozzr might actually help. What I really liked about her story was how, the whole coronavirus stuff, about how this came from nasal lavages.
Putting terpenes up people's noses to prevent what we're going to say, the coronavirus from getting a foothold. Yeah, I thought that was very interesting.
But I mean, a nasal lavage is to flush out, the impurities,
right.
And some people use it, and I must tell you that in my past I have done nasal lavages when I've been congested, and it does work. Don't use tap water. There's now some issues about tap water being bad and giving you, from our last episode about molds and funguses.
Little brain fungus.
Yes, you want to use distilled water. You want to use, clean water. But how she developed this through her RT practice. I am sold on it in the sense of a way of vaping cannabis. It really pops the terpenes of the flowers, and its immediate response. Again, the only difficulty for me was that I found I was sneezing later in the day with irritation in the nose. But yeah, it's a fabulous product. I don't want to be seen flogging a product. That's not what my goal here is.
No, you're stating your personal opinion after trying it, which I think is perfectly valid.
So if you are using vaporized flower, I would suggest checking out the Nozzr as a way of appreciating your terpenes. And I got to do more research, man, on the route of administration. Maybe the next episode we'll come back.
Yeah, no. And like I said, everything she said made sense, because there are sort of dangly bits of the brain into the back of the nose. So is the terpene going... So for sure, uncontroversially, it will go into the bloodstream really fast. So that makes sense. Back to, we'll use cocaine because everyone loves that. That's why snorting cocaine works so well. It goes into the bloodstream really quickly. Does it go directly into the brain? Everything she said made sense, but yeah, you'd have to look into that a little more.
The interesting thing about cocaine, though, is it's a vasoconstrictor. So
yeah,
I mean, we use it used to use it for extreme nosebleeds at one time.
Yes, yeah, I was going to say, people love the fact that I say, back in the day they would actually pack cocaine into people's noses, and
I have. Back in the 80s. Back in the 80s, we used to have cocaine in the narcotic cupboard, and it was pure uncut cocaine, and we'd have to count it at every shift, and there's a few times where I used it in nosebleeds, stuffed it up a guy's nose. Yep.
And it worked well in dentistry too, because it was a local anesthetic, so it numbed the area and it stopped the bleeding. It was good stuff. Has some other issues, but pharmacologically it served a purpose. But we are getting away from Nozzr. I think we should probably wrap this one up again. Yvette, it was fantastic talking to you for these 2 episodes. I really enjoyed it. Keep us up to date with all the stuff that your various companies are doing.
It was a fun episode, and it's an interesting product. So thanks again for getting hold of us, and cheers. Oh, who are we? I guess we introduced ourselves.
Yeah, we didn't do that again. Okay, I'm Trevor Schufeld. I'm the pharmacist.
I'm Kirk Nyquist. I'm the registered nurse, and you are listening to Reefer Madness, the podcast. I'm a proponent of going to our webpage. If you are a new listener, go to our webpage. You can search out our topics, our guests, the affiliations, the organizations we talk to. It's a researchable website, but we are found on all of the podcast providers, platforms as Reefer Madness or Reefer Med. I should actually tell you, the last few days, I've been volunteering for the food program, and the chef of the food program for the schools.
Food for thought.
Talking, huh?
Food for Thought. The program's called Food for Thought. Good job.
Food for Thought, yep. And I was talking to the chef, and he found out we had a podcast. He's a cannabis-centric kind of guy, and he's actually starting at episode 1, and he's moved forward, and he really enjoyed Aaron Bedin in episode 3. And I said, buddy, you got a couple of years of listening going on there, but we have a new listener.
Excellent. So, welcome aboard. And if you're a brand new listener to us too, welcome aboard. Let us know what you think, and we'll talk to everybody again later.
Cheers.
Check out the complete library of Reefer Madness episodes at reefermed.ca. And make sure to follow us on all the socials for bonus info on what Trevor and Kirk are up to.
Stop. Just stop.
I've never. Clive tells me that all the time. I can't help it. My head's just going everywhere. This is the cannabis talking.